The NHS was carried into existence on 5th of July 1948, amid the aftermath and destruction of World War II. It promised cradle-to-grave healthcare, free at the point of need, for everyone. In 2018, the health service marks its 70th anniversary, but the way it looks today and what we expect from it has changed beyond all recognition, and that is largely down to the change in our population and the change in the job we expect the health service to perform. Back in 1948, when the NHS began, the average life expectancy for men was about 63 years old. Today, it's approaching 79. For women, it was closer to 71 and it's now pushing 83. Infant mortality has also fallen drastically, from around 34 deaths per 1,000 newborns to just 3.8 in 2018. This shifting age profile is a sign of modern medical success. There simply weren't treatments for many conditions, and complex surgery was often a death sentence. In 1948, if you went into hospital, you were either fixed and sent home, or you weren't. But either way, that was the end of the health service's involvement. Today, 15 million people have at least one long-term condition, such as diabetes, COPD, high blood pressure. These account for 70p in every pound spent on healthcare in the UK. And as our population ages and medicine advances, that bill is only going to grow. To tackle this, the government has looked at moving healthcare prevention further upstream. So you're no longer first seeing the NHS after you have a major heart attack, but you might be having an exercise class in school. However, this expanded remit for prevention, while a lot cheaper, has to be featured alongside other major advances: MRIs, IVF, chemotherapy, which wasn't even conceived of at the time the NHS was born. While care that is free for all is probably the most succinct definition of the NHS, the unending argument about how that should be funded has become an equally important part of our national identity. Tax rises dedicated to the NHS have been shown to have broad public support in polls. There is also a fabled Brexit dividend expected along any minute. But for much of the NHS's life, its budget has risen for 4% every year. In the last 8 years, it has only risen by around 1% on average. And this has created an inevitable pressure and a search for new ways to fund it. Today, any suggestion of charging for extra healthcare services will see the public, the media and MPs of all stripes round on its proposer. But the first fees were actually introduced just 5 years after the NHS was set up. First for dentistry and then for prescription charges for common medications. Technology is also changing the way we think about healthcare. There has been an influx of paid-for GP video appointment apps, which would suggest that many of us are willing to part with a bit of money in order to jump the queue that has developed in the last 8 years. How the NHS adopts these technologies and other advances that haven't come along yet will be the defining characteristic of what the NHS looks like and how we think of it in the next 70 years.